Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where you see that I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 30-year-old female presents with a 3 day history of dysuria, urinary frequency, and lower abdominal discomfort. She denies fever or flank pain. On exam, she is afebrile and a urine dipstick shows positive leukocytes and nitrites. What is the most likely diagnosis? Is it A, pyelonephritis, B, a UTI, C, interstitial cystitis, or D, bacterial vaginosis? Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most likely diagnosis? And y'all know my rule, what I tell y'all, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. How are they presenting? What is their chief complaint? What are their chief complaints? Um, and pay attention to the age, the ethnicity, and the gender, right? Because that can also help in diagnosing and treating. So, a 30-year-old female, she's had a 3 day history of dysuria, urinary frequency, lower abdominal discomfort. So, you should start to think of, urinary tract infections, right? She's denying any fever or flank pain, so that should rule out pyelonephritis as flank pain with these associated symptoms of the dysuria, urinary frequency, etc. It's classic for pyelonephritis, right? And then confirmation are diagnostics with the positive leukocytes and nitrites confirms that there's a urinary tract infection. So B is your best answer. All right, question number two. A 25-year-old female presents with symptoms of dysuria, urinary frequency, and urgency. A urine dipstick test shows positive leukocytes and nitrites, and she is otherwise healthy with no fever or systemic symptoms, right? So, what is the most appropriate antibiotic treatment for her? Is it A, nitrofurantoin for 3 to 5 days, B, amoxicillin for 7 to 10 days, C, Bactrim for 7 to 10 days, or D, Cipro for 7 to 10 days? Take a moment and tell me what you got in the comments, you guys. What do you have? All right, so similar question here states, what is the most appropriate antibiotic treatment for her? So we have a 25-year-old female who presents with symptoms of dysuria, urinary frequency, and urgency, right? So we're starting to lean towards thinking a UTI. Leukocytes, nitrites are positive. That's confirming a UTI. There's no fever or any other symptoms systemically. So how would we treat? All right, so with this, not only is this a UTI, but it's an uncomplicated UTI. Remember, our complicated UTIs are our pregnant women, the elderly population, men, someone who may have already had this UTI and are coming back because the treatment did not resolve the issue. So, with this, one, we know nitrofurantoin is one of our first line therapy of UTI treatment. But when we treat something uncomplicated, the uncomplicated UTIs, the duration is from 3 to 5 days. So the others you can rule out because 7 to 10 days is for our complicated UTIs. Okay, so A is your best answer. And then lastly, question number three. A 28-year-old pregnant female at 12 weeks gestation presents with dysuria, urinary frequency, and mild lower abdominal discomfort. Her urine dipstick test is positive for leukocytes and nitrites. What is the most appropriate management for her urinary tract infection during pregnancy? Select the best two. All right, so A, nitrofurantoin for 3 to 7 days, B, Cipro for 7 to 10 days, C, Bactrim for 3 to 5 days, or D, amoxicillin or ampicillin for 7 days. Take a moment and tell me what you got. All right, so stem of the question here states, what is the most appropriate management for her urinary tract infection during pregnancy? Select the best two, right? All right, so when we're selecting the best two, you want to make sure anytime it says this, don't forget that if you need to highlight it or do whatever, because there are highlight options on the exam. If you need to do it so you're not forgetting that you're selecting two answers or three answers versus one, please do that because you don't want to miss it because you just forgot to select an additional answer. But here in the pregnant population, things to consider and what to treat. You want to go with nitrofurantoin as well as your amoxicillin or ampicillin. Now, if we are speaking duration, the best answer would be your amoxicillin or ampicillin for 7 days, as the penicillins are safe during this period of time of pregnancy, but also for that 7 day period because pregnant women are considered complicated UTIs. Nitrofurantoin, 3 to 7 days, it reaches right on that cusp of 7 days, but nitrofurantoin is also safe during pregnancy. You know, we don't give Bactrim or sulfamides to pregnant women, so you can eliminate C, and Cipro also, we wouldn't want to give that. So A and D are your best answers. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, they're all linked in the bio of this channel, including my website with all of the resources. But feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. And if you're looking to book any one on one sessions, please feel free to reach out either by calling, texting, or email. As you know, I always tell y'all, I offer a variety of one on one session types. So I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session. All right, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.